Welcome to the Victory Education Lounge, where we dive into the future, one innovation at a time. Today, we are exploring a topic that is set to revolutionize our approach to public health, and that's artificial intelligence, or AI. AI, in essence, is a multidisciplinary field of science capable of simulating human intelligence in machines. It's an exciting frontier, not just for tech enthusiasts, but also for the world of public health. This fusion of health and technology is creating a paradigm shift, transforming how we predict, prevent, and manage health issues. Imagine a world where health crises like epidemics and pandemics are predicted before they even occur. Sounds like something out of a sci-fi novel, right? But that's the potential of AI. By analyzing vast amounts of data from diverse sources, AI can help us identify patterns and predict potential health crises. This gives us a crucial head start in containment and response, ultimately saving lives and resources. But the power of AI in public health doesn't stop at prediction. It's also revolutionizing patient care. AI's ability to learn from and interpret complex data allows for a more personalized approach to treatment. It takes into account the unique characteristics of each patient, tailoring treatment plans to the individual. This not only improves health outcomes, but it also enhances the patient experience, making healthcare more efficient and accessible. In a nutshell, the integration of AI in the field of public health holds immense promise. It's like giving a superpower to healthcare professionals. They are no longer limited by traditional constraints, but are empowered to predict, personalize, and prevent. Yet, as with any powerful tool, the use of AI in public health comes with its own set of challenges. It necessitates a careful balance between innovation and ethics, particularly when it comes to data privacy. But more on that later. For now, let's marvel at the transformative potential of AI in public health. From predicting outbreaks to personalizing patient care, AI is at the forefront of a health transformation. Imagine being able to predict an epidemic before it even happens. That's not a scene from a science fiction novel, but a reality that's unfolding right before our eyes, thanks to artificial intelligence, or AI. With the power to analyze massive amounts of data from various sources, AI can identify patterns that often escape the human eye. These patterns can give us invaluable insights into potential outbreaks, allowing us to take preventative measures before they occur. Imagine the difference that could make, not just in terms of the number of lives saved, but also in terms of the economic impact. Now let's hear from an expert in public health. They're at the forefront of integrating AI into our healthcare systems, and they've seen firsthand the transformative potential of this technology. Expert. The beauty of AI lies in its predictive power. We're no longer just reacting to health crises after they've happened. Instead, we're using AI to anticipate these crises. This shift from a reactive to a proactive approach could be the difference between a manageable health situation and a full-blown crisis. It could save millions of lives. That's powerful, isn't it? The ability to anticipate, to prepare, to act before a crisis hits. That's a game changer. And it's not just about predicting outbreaks. AI can also help us understand the factors that contribute to these outbreaks in the first place. It can help us identify vulnerable populations, understand the role of environmental factors, and much more. But it's also important to remember that while AI offers immense potential, it's not a silver bullet. It's a tool, and like any tool, its effectiveness depends on how we use it. It requires the right data, the right algorithms, and the right people to interpret and act on its predictions. So as we embrace the power of AI in public health, let's also remember our responsibility to use it wisely, ethically, and responsibly. Because at the end of the day, this proactive approach could save millions of lives. But AI's impact doesn't stop at prediction. It's a veritable powerhouse that is revolutionizing the way we approach patient care. One of the most exciting developments in this field is how AI leverages machine learning and data analysis to provide personalized treatment plans. This isn't a one-size-fits-all approach. It's a tailored, patient-centric model that takes into account the unique needs, preferences, and medical history of each individual. To understand this better, let's consider the case of a patient with diabetes. Diabetes is a complex condition that requires careful management. Traditionally, this has involved routine checkups, manual adjustments of insulin levels, and constant vigilance. But with AI, this process can be automated and fine-tuned to an unprecedented degree. Imagine a system that continuously monitors the patient's health data, blood sugar levels, diet, exercise patterns, even sleep habits. This data is then analyzed in real time, with AI algorithms detecting subtle patterns and trends. Based on this analysis, the system can adjust the patient's insulin levels automatically, ensuring they remain in the optimal range. But it doesn't stop there. If the system detects a potential risk, say a sudden spike in blood sugar levels, it can alert the healthcare providers immediately. This means potential emergencies can be identified and addressed before they escalate, leading to better outcomes and less stress for the patient. This is just one example of how AI is personalizing patient care. From cancer treatment to mental health services, the possibilities are endless. By harnessing the power of AI, we can move away from a reactive model of healthcare to a proactive one, where prevention is just as important as treatment. So, as we embrace the future of public health, let's remember that AI is more than just a tool for predicting health crises. It's a powerful ally in our quest for personalized, patient-centric care. AI can monitor their health data in real time, adjusting insulin levels automatically, and alerting healthcare providers to potential risks before they become emergencies. On a global scale, AI is a game-changer for health equity. It's a beacon of hope, illuminating the dark corners of healthcare disparities and guiding us towards a world where quality healthcare isn't a privilege, but a right for all. Artificial intelligence is democratizing access to healthcare like never before. It's breaking down the walls of traditional healthcare systems, bridging the divide between urban and rural, between developed and developing countries. It's altering the very landscape of healthcare delivery, making it more inclusive, accessible, and efficient. Consider the vast rural expanses or remote areas where access to a doctor, let alone a specialist, is a luxury. Now imagine a world where a doctor's expertise is just a click away, irrespective of where you are. That's the power of AI in healthcare. Through telemedicine, AI is bringing medical consultation to the doorsteps of those who need it the most. It's empowering individuals with tools to manage their health, offering expert consultation, diagnosis, and treatment plans right at their fingertips. It's no longer about where you live, it's about having access to the internet. AI is also making strides in equalizing access to preventive health care. By analyzing health data from a wide range of sources, AI can predict health risks and guide preventive measures. This not only reduces the burden on healthcare systems but also empowers individuals with knowledge about their health. But AI's role in health equity isn't just about accessibility, it's about quality too. By analyzing vast amounts of health data, AI can tailor treatment plans to the individual, thereby improving outcomes. It's about ensuring that every individual, no matter where they are, receives the best possible care. The potential of AI in bridging the health equity gap is immense. It's a tool of empowerment, an agent of change, a catalyst for a healthier, more equitable world. As we move forward, the key is to harness this potential responsibly, ensuring that AI's benefits reach every corner of the globe. Telemedicine, powered by AI, brings expert consultation to the remotest of areas, ensuring that geography is no longer a barrier to quality care. However, with great power comes great responsibility. As we delve deeper into the realm of artificial intelligence, we are faced with an increasingly pertinent question. What about data privacy and ethics? AI's transformative potential in public health is undeniably profound, but it must be balanced with a commitment to protecting personal information and upholding ethical standards. We live in an age where data is the new oil, and its value, especially health data, is immeasurable. From disease prediction to personalized care, AI relies heavily on the collection and processing of vast amounts of data. But this valuable resource must be handled with care. Every byte of data corresponds to a real individual, with real rights and real concerns about privacy. It's paramount that we ensure the secure and ethical use of health data to maintain trust and protect individual rights. Moreover, while AI's potential to democratize healthcare access is exciting, we must not overlook the ethical implications. What about consent? Are people aware that their data is being used, and if so, do they understand how? It's not enough to merely inform. We must ensure that consent is informed and ongoing, respecting individuals' autonomy over their personal information. Now let's hear from an expert in the field. Transparency and regulation are key, they say. AI has the potential to revolutionize public health, but it must be held accountable. This means clear guidelines for data usage, robust security measures, and stringent oversight. And above all, it must be transparent. People have a right to know how their data is being used, and this should be communicated clearly and honestly. As we continue to navigate the frontier of AI in public health, let's remember this. Technology is a tool, powerful, yes, but ultimately, a tool. It must serve us, not the other way around. We must ensure that AI serves the public good, respecting privacy and consent every step of the way. The future of public health is here, and it's powered by AI. As we've journeyed through the transformative impact of artificial intelligence on public health, we've seen its potential in predicting health crises before they happen. We've seen how it can personalize patient care, making treatment not just a one-size-fits-all approach but a tailored, individualized plan. We've also seen how AI can bridge the health equity gap, democratizing access to quality healthcare and ensuring geography is no longer a barrier to receiving the care one needs. But let's remember, with all these advancements comes the need for responsible navigation. AI is a tool, a powerful one at that, and like any tool, it needs to be used carefully and ethically. This means being vigilant about data privacy, ensuring that the health data used to fuel these AI innovations are secure and used ethically. Transparency is key here, as is regulation. We must all be proactive in ensuring that AI serves the public good, respecting privacy and consent every step of the way. And let's not forget, the future of public health is not just about AI. It's about all of us. It's about our commitment to health and well-being, our drive to innovate, and our dedication to making the world a better place. It's about ensuring that technology serves humanity, not the other way around. As we continue to move forward, let's remember to do so responsibly. Let's embrace the potential of AI, but let's also be mindful of the risks. Let's continue to push the boundaries of what's possible, but let's also remember to respect the boundaries of what's ethical. The future of public health is an exciting one, filled with endless possibilities. It's a future where AI plays a crucial role, where technology and well-being intersect in remarkable ways. But it's also up to us to navigate this future responsibly, ensuring that technology serves humanity, not the other way around. Welcome to the Victory Education Lounge, where knowledge meets innovation to shape the future. Today, we're delving into a topic that's transforming the landscape of healthcare: artificial intelligence. This isn't just about robots and algorithms, it's about harnessing the power of technology to enhance public health, from predicting disease outbreaks to personalizing patient care. So buckle up and get ready to explore the astonishing world of AI in healthcare. Now let's embark on a journey to explore how artificial intelligence, or AI, is revolutionizing public health. Ready? Let's go. In an era where technology is at the forefront of innovation, AI has emerged as a game changer, particularly in the realm of public health. So, what is AI? Simply put, it's the simulation of human intelligence in machines that are programmed to think and learn like us. Now, why does AI matter in public health? Well, it's because AI holds the potential to transform public health dramatically. From enhancing disease surveillance to improving diagnostic accuracy and personalizing patient care, AI is redefining the boundaries of what's possible in health. As our expert puts it, AI is not just a tool, but a revolution, a shift in how we approach health and wellness. And one of the most significant impacts of AI, its ability to predict and prevent outbreaks before they escalate into public health crises. Yes, AI is taking the fight against disease to a whole new level. Take, for example, AI prediction models that accurately forecasted the spread of diseases like COVID-19, allowing governments to implement timely interventions. Imagine a world where we can predict disease outbreaks, even before the first case is reported. Sounds like science fiction, right? But with the power of artificial intelligence, this is becoming a reality. AI prediction models are like crystal balls, peering into the future of public health. They sift through mountains of data, spotting patterns and trends that even the sharpest human minds might miss. Consider the case of COVID-19. In the early days of the pandemic, AI models were hard at work, analyzing data from various sources, including travel patterns, social media posts, and health reports. These models predicted the spread of the virus, and their forecasts were eerily accurate. One such model developed by Blue Dot, a Canadian AI firm, warned of the potential outbreak days before the World Health Organization made its official announcement. This early warning gave governments and health organizations a head start, enabling them to implement interventions, such as travel restrictions and health advisories, in a more timely manner. But it's not just global pandemics. AI prediction models are also being used to forecast the spread of other diseases, from seasonal flu to dengue fever. By predicting where and when these diseases are likely to strike, public health officials can proactively deploy resources, vaccinate vulnerable populations, and ramp up hospital preparedness. Furthermore, AI prediction models are helping us understand the impact of social determinants on health outcomes. By analyzing factors like income, education, and access to healthy food, these models can predict who might be at higher risk for certain diseases, allowing for targeted prevention efforts. In short, AI prediction models are transforming the way we approach public health, shifting the focus from reaction to prevention. They're providing us with a roadmap to navigate the complex landscape of disease spread, helping us stay one step ahead of the next health crisis. But AI's role doesn't stop at prediction. It extends to diagnosis and treatment, offering a new level of precision medicine tailored to individual patient needs. With AI, we're able to analyze vast amounts of data to identify patterns and diagnose diseases much earlier than traditional methods. This statement from a healthcare professional paints a vivid picture of how artificial intelligence is reshaping the landscape of diagnosis and treatment. Imagine a world where diseases are not just diagnosed but predicted. AI does this by crunching vast amounts of data, analyzing patterns, and identifying potential health risks much before they manifest into visible symptoms. It's like having a personal health forecaster who can predict the weather of your body's health landscape. But how does this work in real-life situations? Let's hear it from the professionals themselves. Dr. Sharma, a renowned oncologist, shares her experience with AI. In my field, she says, early detection of cancer can significantly improve survival rates. AI helps us analyze subtle changes in patient scans, often catching tumors that the human eye might miss. It's like having an extra set of highly trained eyes. And it's not just about diagnosis. AI is equally transformative in the treatment phase. Let's hear from Dr. Rodriguez, a leading neurosurgeon. In complex surgeries, precision is key, he explains. AI assists us in mapping the patient's brain, allowing us to perform surgeries with unprecedented accuracy. It's like having a GPS for the human body. Another significant contribution of AI is in the field of personalized medicine. Instead of a one-size-fits-all approach, AI enables us to tailor treatments to the individual patient. As Dr. Lee, a geneticist, puts it, AI allows us to understand a patient's genetic makeup and predict how they may respond to certain treatments. It's like having a personalized health blueprint. But the potential of AI extends beyond individual healthcare. It's a powerful tool in public health initiatives, particularly in bringing quality healthcare to underserved communities. By analyzing population data, AI can identify health trends and risks in these communities, enabling targeted interventions. To sum it up, AI is not just revolutionizing diagnosis and treatment, it's bringing about a paradigm shift in healthcare, making it more precise, personalized, and accessible. Moreover, AI-driven public health initiatives are bridging the gap in healthcare accessibility, making quality care available to underserved communities around the world. And it's not just about the technology. The integration of AI in public health is fostering a culture of innovation, encouraging multidisciplinary collaborations that push the boundaries of what's possible. Indeed, the power of artificial intelligence is being harnessed globally to tackle some of the most pressing health challenges. From predicting disease outbreaks to streamlining patient care, AI has become an integral part of public health initiatives across the globe. In remote corners of the world, where access to quality healthcare is often limited, AI is making a significant difference. For instance, AI-powered mobile clinics are bringing diagnostic services to communities that previously had little to no access. By analyzing medical data, these mobile clinics can provide accurate diagnoses and treatment recommendations, improving health outcomes in these underserved areas. Moreover, AI is helping to bridge the gap between health professionals and patients through telemedicine. AI-powered platforms are enabling virtual consultations, reducing the need for physical travel, and allowing patients to receive care from the comfort of their homes. This has been particularly beneficial during the global pandemic, as it has minimized exposure risks and ensured continued care for chronic patients. Another exciting development is the use of AI in disease surveillance. Advanced algorithms are being used to analyze vast amounts of data from diverse sources, predicting potential disease outbreaks and enabling swift interventions. This not only saves lives but also helps to manage the strain on healthcare systems. AI is also transforming health education. Interactive AI-powered platforms are helping to train health professionals, providing them with virtual patients and scenarios to enhance their skills and knowledge. This is especially crucial in parts of the world where access to quality education is a challenge. Yet with great power comes great responsibility. As we embrace the wonders of AI, it's paramount to consider the ethical implications. Issues of privacy, consent, and the digital divide are at the forefront of the conversation. As we move forward, it's crucial to ensure that AI serves humanity, upholding the rights and dignity of individuals while promoting health and well-being for all. As we harness AI's potential, we must also safeguard the rights and dignity of individuals, ensuring that technology serves humanity, not the other way around. It's vital to remember that while AI brings immense benefits to public health, it also raises crucial ethical questions. Ethical considerations related to AI and public health revolve around three primary areas: privacy, consent, and the digital divide. Let's delve into these issues one by one. Starting with privacy, the use of AI in public health often involves analyzing vast amounts of personal health data. While this data is instrumental in predicting and preventing disease outbreaks, it also poses a potential threat to individuals' privacy. Therefore, it's critical to have robust data protection measures in place to prevent unauthorized access and misuse of sensitive health information. Next, we come to consent. Health data used for AI applications should be obtained with explicit, informed consent from the individuals involved. This means they should fully understand how their data will be used and have the option to opt out if they wish. It's important to note that informed consent isn't just a one-time process. It's an ongoing dialogue between the data collector and the individual. Lastly, the digital divide. While AI technologies hold the promise of improving public health, they also risk widening the gap between those with access to digital resources and those without. To ensure that the benefits of AI are equitably distributed, we must actively work towards bridging this digital divide. Experts in the field emphasize the importance of these ethical considerations. As one expert puts it, the goal should always be to use AI to augment human capabilities, not to replace them. That way, we can ensure that AI serves as a tool for improving public health, rather than a means of exacerbating existing inequalities. The journey of AI in revolutionizing public health is just beginning, and the possibilities are endless. As we continue to navigate this exciting frontier, let's remember to keep these ethical considerations at the forefront of our minds. After all, the ultimate goal of public health is to improve the health and well-being of people around the world, and that includes safeguarding their rights and dignity in the process. In conclusion, AI is not just a tool, but a catalyst for change in public health. It's a game changer, reshaping the landscape of healthcare by enhancing disease surveillance, improving diagnostic accuracy, and personalizing patient care. From accurately predicting disease outbreaks to offering a new level of precision in medicine, AI is pushing the boundaries of what's possible. But it's not just about the technology. The integration of AI in public health is fostering a culture of innovation. It's encouraging multidisciplinary collaborations, bridging the gap in healthcare accessibility, and making quality care available to underserved communities globally. However, as we continue to harness the potential of AI, we must remain mindful of the ethical considerations. Privacy, consent, and the digital divide must stay at the forefront of the conversation. We must ensure that technology serves humanity, not the other way around. Therefore, I encourage you to continue learning about AI and its impact on public health. The journey of AI and revolutionizing public health is just beginning. And as we navigate this new era of healthcare, let's remember to use this powerful tool responsibly and ethically. Remember, the future of public health is not just about technology, but about how we use it to create a healthier world for all. Thanks for watching, and stay curious. Welcome to the Victory Education Lounge, where we explore the future of technology and its impact on our world. Today we're setting sail on a journey of discovery into a world where technology and healthcare intersect in the most extraordinary way. Picture this, a world where illnesses are predicted before they occur, where health emergencies are anticipated and prepared for, not merely reacted to. Sounds like science fiction, right? Well, not anymore. This is the world of artificial intelligence, or AI, in public health. AI is not a newcomer to our world. It has been making waves in various sectors for quite some time now. But its venture into public health is a game changer. It's not just about improving processes or increasing efficiency, it's about saving lives, millions of them. Imagine, if you will, a world where we can predict an epidemic before it even happens. A world where public health decisions are not just educated guesses, but are informed by data-driven insights so precise, they seem almost psychic. This is not a distant dream. This is the reality AI is creating for us in public health. AI's ability to analyze vast amounts of data in real time is a game changer. It means we can identify patterns and predict outbreaks much faster than traditional methods. But how does it work? At its core, AI uses algorithms to sift through data from various sources, social media, healthcare records, even satellite imagery, to forecast health trends and potential outbreaks. This isn't just about handling what's in front of us, it's about anticipating what's next. Consider the case of dengue fever in a tropical country. By analyzing weather patterns, population density, and previous outbreak data, AI models were able to predict a surge in cases with stunning accuracy, allowing authorities to mobilize resources ahead of time. But predictive medicine isn't just about combating epidemics. It's also about personalized healthcare, tailored to each individual's unique genetic makeup, lifestyle, and risk factors. AI can help doctors design more effective treatment plans, predict potential side effects, and even suggest preventive measures tailored to the individual. Artificial intelligence, or AI, is no longer the stuff of science fiction. It's here, and it's making strides in predictive medicine that could save millions of lives. Imagine a world where we can predict an epidemic before it even happens. A world where public health decisions are informed by data-driven insights so precise, they seem almost psychic. Sound like a distant dream? It's not. This is the reality artificial intelligence, or AI, is creating for us in public health. AI's ability to analyze vast amounts of data in real time is a game changer. It means we can identify patterns and predict outbreaks much faster than traditional methods. But how does it work? At its core, AI uses algorithms to sift through data from various sources, social media, healthcare records, even satellite imagery, to forecast health trends and potential outbreaks. Consider the case of dengue fever in a tropical country. By analyzing weather patterns, population density, and previous outbreak data, AI models were able to predict a surge in cases with stunning accuracy. This allowed authorities to mobilize resources ahead of time, potentially saving countless lives. But predictive medicine isn't just about combating epidemics, it's also about personalized healthcare, tailored to each individual's unique genetic makeup, lifestyle, and risk factors. AI can help doctors design more effective treatment plans, predict potential side effects, and even suggest preventive measures tailored to the individual. With AI, we're not just treating diseases, we're preventing them. It's a proactive approach to health, one that could significantly reduce the burden on our healthcare systems. And while it's not without its challenges, especially concerning privacy and data security, the potential benefits for public health are immense. This isn't just about handling what's in front of us, it's about anticipating what's next. The power of prediction, enabled by AI, could revolutionize public health and usher in a new era of predictive medicine. And while we're still in the early stages, the possibilities are truly exciting. So, let's keep our eyes on the horizon, because the future of public health is looking brighter than ever. Consider the case of dengue fever in a tropical country. Dengue, a mosquito-borne disease, is a significant public health concern in many parts of the world. The ability to predict an outbreak could be a game changer, saving countless lives and precious resources. In this particular case, AI played a pivotal role in predicting a dengue outbreak. The AI model used for this task was designed to analyze multiple factors that contribute to dengue fever's spread. This included weather patterns, as the disease often sees an uptick in cases during the rainy season when mosquitoes are most active. The AI model also looked at population density, as crowded urban areas often see a higher rate of cases due to the increased human-to-mosquito contact. But the AI didn't stop there. It also took into account data from previous outbreaks. By understanding when and where dengue fever had struck before, the AI could infer patterns and trends, further sharpening its predictive capabilities. The results were nothing short of impressive. The AI model was able to predict a surge in dengue cases with stunning accuracy. This wasn't just a rough estimate, but a detailed forecast, pinpointing where the outbreak would hit the hardest and when. This prediction didn't just sit on a computer screen gathering digital dust. It was used to inform public health decisions, allowing authorities to mobilize resources ahead of time. Mosquito control efforts were ramped up in predicted hotspots, healthcare facilities were prepped to handle an influx of cases, and communities were educated about preventative measures. In the end, the AI's prediction was spot on. The outbreak did come, but thanks to the advance warning, the impact was significantly lessened. Fewer people fell ill, fewer resources were strained, and fewer lives were disrupted. This case study is a powerful demonstration of how AI can be used in public health. It's not just about data or algorithms, it's about using these tools to protect communities, save lives, and make the world a safer place. AI models were able to predict a surge in cases with stunning accuracy, allowing authorities to mobilize resources ahead of time. But predictive medicine isn't just about combating epidemics. It's also about personalized healthcare, a concept that's revolutionizing the way we approach medicine. Let's delve into this fascinating aspect of healthcare. Think of personalized healthcare as a tailor-made suit, designed to fit you perfectly. In the same way, your healthcare can be tailored to your unique genetic makeup, lifestyle, and risk factors. And this is where artificial intelligence comes into play. AI can analyze your genetic data, lifestyle habits, and medical history to create a detailed health profile. This profile can then be used to predict potential health risks and suggest preventive measures. It's like having a crystal ball that reveals your future health status. Imagine visiting a doctor who already knows the potential health problems you might face in the future. They're not just treating your current symptoms, they're also equipped to prevent future health issues. This is the power of personalized healthcare empowered by AI. Moreover, AI can help doctors design treatment plans that are more effective for you. Instead of a one-size-fits-all approach, each treatment plan can be customized according to your unique health profile. This means that your treatment is more likely to be effective, and you're less likely to experience adverse side effects. AI can also help doctors anticipate potential side effects of medications. By analyzing your genetic data, AI can predict how you're likely to react to certain medications. This can help your doctor choose the most effective medication for you, while minimizing the risk of side effects. In addition, AI can also suggest lifestyle changes that can improve your health. By analyzing your lifestyle habits and genetic data, AI can provide personalized recommendations for diet, exercise, and other lifestyle changes that can help you maintain good health. In conclusion, AI is not just revolutionizing predictive medicine, it's also reshaping personalized healthcare. By analyzing individual data, AI can help doctors design more effective treatment plans, predict potential side effects, and even suggest preventive measures tailored to the individual. The future of healthcare is here, and it's personalized. With AI, we're not just treating diseases, we're preventing them. This statement marks a paradigm shift in healthcare, ushering in an era where prevention is as important, if not more so, than cure. Now let's delve deeper into the implications of AI in patient care. Artificial intelligence offers a proactive approach to health, a philosophy that could significantly reduce the burden on our healthcare systems. By predicting potential health issues before they become serious, AI enables early interventions that can lead to better patient outcomes. It's like having a guardian angel who knows your health risks and works tirelessly to keep you safe. But it's not just about individual health. AI's predictive power can also help manage public health crises. By predicting disease outbreaks, AI can help authorities take preventive measures, reducing the strain on hospitals and potentially saving countless lives. On a more personal level, AI can revolutionize patient care by making it more personalized. Using AI, doctors can design treatment plans tailored to each individual's unique genetic makeup, lifestyle, and risk factors. This means more effective treatments, fewer side effects, and a higher quality of life for patients. However, the implementation of AI in healthcare is not without its challenges. As we harness the power of AI to process vast amounts of personal health data, we must also address serious concerns about data privacy and security. Ensuring the ethical use of AI and protecting patient data must be a top priority as we navigate the future of predictive medicine. Moreover, there are concerns about the potential for AI to exacerbate health disparities. If not implemented thoughtfully, AI could inadvertently favor those with access to advanced healthcare technologies, leaving vulnerable populations behind. Despite these challenges, the potential benefits of AI in patient care are immense. It offers a future where healthcare is not just about treating sickness, but about promoting overall wellness. A future where every patient receives personalized care, and where public health crises can be managed more effectively. And it's not without its challenges, especially concerning privacy and data security, but the potential benefits for public health are immense. AI is not just a tool, it's a paradigm shift in the way we approach public health. It's the dawn of a new era where data-driven insights take center stage, where foresight replaces hindsight, where prevention takes precedence over cure. We've explored fascinating ideas today, from AI's stellar capabilities in predicting disease outbreaks, to its potential in delivering personalized healthcare. We've seen how it can analyze vast amounts of data in real time, identifying patterns that would otherwise go unnoticed. This ability to foresee health trends and potential epidemics is not just revolutionary, it's life-saving on a global scale. We delved into a case study of dengue fever, where AI models predicted a surge in cases with remarkable accuracy. By taking into account factors like weather patterns and population density, these models enabled authorities to act proactively, saving countless lives and resources. But predictive medicine isn't confined to the realm of public health. It's also about personalizing healthcare, tailoring it to the individual's unique genetic makeup, lifestyle, and risk factors. We've discussed how AI can assist doctors in designing more effective treatment plans, forecasting potential side effects, and suggesting preventive measures that are specific to the individual. We've also acknowledged the challenges that come with this technology, especially concerning privacy and data security, but the potential benefits for public health are immense and cannot be ignored. As we move forward, it will be crucial for us to strike a balance between leveraging AI's potential and safeguarding our privacy. As we step into the future, it's clear that AI will play a key role in shaping a new era of predictive medicine, one that's proactive, personalized, and incredibly precise. It's a future where technology and healthcare walk hand in hand, where AI is not just a tool but a partner in our quest for a healthier world. Welcome to the Victory Education Lounge, your go-to place for insights into how technology is shaping our world. In our rapidly evolving digital era, one technology stands out as a game changer in a multitude of sectors, including healthcare, artificial intelligence. Today we're delving into the fascinating realm of AI as a new frontier in fighting global health crises. We'll explore how this remarkable technology is transforming the way we approach and tackle health challenges, from pandemics to chronic diseases. We'll delve into the role of AI in data analysis, its application in diagnostics and patient care, and the ethical considerations that accompany its use. We will also highlight global initiatives that are striving to make AI-driven healthcare solutions inclusive and accessible to all. So join us on this enlightening journey as we uncover how AI is revolutionizing our approach to health challenges that affect humanity on a global scale. Artificial intelligence, or AI, is no longer just a buzzword. It's a dynamic tool that's revolutionizing the way we approach health crises. But what role does AI play in all of this? Let's delve into the fascinating world of data analysis, a field where AI is making significant strides. Imagine a world where we can predict a disease outbreak before it happens, or understand the patterns of chronic illnesses to develop more effective treatments. With AI, this is becoming a reality. The sheer volume of health data generated globally is staggering, and AI is instrumental in making sense of it all. Picture a massive, intricate puzzle. Each piece represents a bit of health data, a patient's symptoms, their medical history, the progression of a disease, and so on. Now imagine trying to piece together this puzzle to understand the bigger picture. It's a daunting task, isn't it? That's where AI comes in. AI algorithms can sift through these vast amounts of data, spotting patterns and correlations that might be invisible to the human eye. These patterns can reveal critical insights about disease trends, risk factors, and potential outbreaks. Think of it as having a super smart assistant who never sleeps, tirelessly working to analyze data and provide us with invaluable information. An assistant who can identify a potential pandemic in its early stages or predict the spread of a disease based on various factors. But it's not just about prediction. AI's data analysis capabilities also play a significant role in prevention and control. By understanding disease patterns, we can develop effective strategies to prevent the spread of diseases and control them when they occur. For instance, AI can help us understand how a virus spreads in different conditions, enabling us to strategize better and counteract the spread. It can also help us identify which populations are most at risk and need immediate interventions. The role of AI in data analysis is transformative. It's like having a crystal ball that helps us foresee and respond to health crises more effectively. This means we can identify disease patterns, predict outbreaks, and develop strategies for prevention and control at speeds and scales never before imagined. And it's not just about data analysis. The true power of AI reveals itself when it comes to diagnostics and patient care. Aiding healthcare professionals, AI is transforming the way we approach disease detection, patient care, and even the development of new treatments. Imagine this. You're a doctor in a bustling clinic. Each day, you see hundreds of patients with a myriad of symptoms. It's a complex jigsaw puzzle, and you're tasked with piecing together the clues to form a clear picture of each patient's health. Now imagine having an intelligent tool that can sift through thousands of data points in seconds, helping you make more accurate diagnoses faster than ever before. That's the magic of AI in diagnostics. But the wonders of AI don't stop at diagnosis. In patient care, AI is proving to be a game changer. With its ability to monitor health data in real time, AI can alert healthcare professionals to any changes, allowing them to intervene promptly. This can reduce hospital readmissions, improve patient outcomes, and enhance the overall efficiency of healthcare delivery. Moreover, AI is also instrumental in treatment development. By analyzing large data sets and identifying patterns, AI can help researchers understand diseases better and develop more effective treatments. For instance, in the fight against cancer, AI algorithms can analyze millions of cancer cells in a matter of minutes, identifying patterns that could lead to the development of more targeted therapies. To provide a professional perspective on this, let's hear from a healthcare professional who uses AI in her daily practice. She shares, "In the field, AI tools help us diagnose diseases earlier and with greater accuracy. They also allow us to monitor patients' health more closely and intervene promptly when needed. The end result? Better patient care, more effective treatments, and ultimately, better health outcomes." In essence, AI is revolutionizing the way we diagnose, treat, and care for patients. It's empowering healthcare professionals to work smarter, not harder, and most importantly, it's improving the lives of patients around the world. For patients, this can mean faster treatment and better outcomes. The potential is incredible, but with great power comes great responsibility. As we delve deeper into the world of AI and healthcare, it becomes increasingly important to discuss the ethical considerations that come with it. Artificial intelligence, with its ability to analyze data at an unprecedented scale, brings with it a host of ethical questions. For instance, how do we ensure the privacy and security of the vast amounts of personal health data being processed? It's not just a question of technical capability, but a fundamental respect for individual rights and dignity. Moreover, AI's decision-making processes are often complex and opaque, leading to what some experts call the black box problem. If we are to trust AI with our health, we must ensure its processes are transparent and explainable. We must be able to understand how AI reaches its conclusions, to ensure they are based on sound, ethical principles. Equally important is the question of bias. Like any tool, AI is only as good as the data it's trained on. If that data is skewed or biased, the AI's decisions will reflect those biases. This could lead to unequal treatment or outcomes, exacerbating existing health disparities. In response to these challenges, experts in AI ethics and public health are working tirelessly to develop guidelines and regulations. They aim to ensure that AI is used ethically, responsibly, and for the benefit of all. This includes principles of transparency, accountability, and fairness, as well as robust measures for data privacy and security. But beyond these considerations, there's another fundamental question: who gets to benefit from AI in healthcare? As we've seen, AI has the potential to revolutionize healthcare, making it more efficient, effective, and personalized. But for this revolution to be truly transformative, it must be inclusive. AI technologies should not just be available to the few, but accessible to all, regardless of socioeconomic status or geographical location. This means taking steps to ensure that AI tools are affordable, easy to use, and available in low-resource settings. It also means investing in education and infrastructure so that everyone has the skills and resources to benefit from AI. As we navigate this new frontier, it's crucial to ensure that AI applications in health are ethical, secure, and accessible to all, regardless of where they live. Absolutely. And that's why initiatives around the globe are not just focusing on innovation but also on inclusivity. In this era of rapid technological advancement, it's crucial that we leave no one behind. We are witnessing a concerted effort from governments, international organizations, and the tech industry to ensure that the benefits of AI in public health are universally accessible. From the bustling metropolises to the remote corners of the world, AI is transforming the way we approach health crises. But this transformation isn't happening in isolation. It's being fueled by a global movement that recognizes the power of inclusivity. Take, for example, the World Health Organization's Digital Health Initiative. This program aims to harness the power of digital technologies, including AI, to improve health outcomes worldwide. It emphasizes the need for universal health coverage, underscoring the principle that access to healthcare, and by extension AI-driven healthcare solutions, is a fundamental human right, not a privilege. Similarly, the United Nations Sustainable Development Goals underscore the importance of leveraging AI to improve health and well-being for all by the year 2030. These initiatives are testament to the global commitment to inclusivity in the realm of AI-powered healthcare. But it's not just about international organizations. Tech companies, startups, and academic institutions are also stepping up to the plate. They're developing AI solutions that are not only innovative but also affordable and user-friendly, breaking down barriers of cost and complexity. From AI-powered mobile apps that can detect symptoms of diseases to AI systems that can analyze medical images with expert precision, these innovations are making high-quality healthcare more accessible than ever before. Inclusivity in AI is more than just a noble ideal. It's a strategic necessity. By ensuring that AI-driven healthcare solutions are accessible to all, we can enhance our collective ability to respond to health crises, reduce health disparities, and ultimately, create a healthier, more equitable world. So as we march forward on this exciting journey, let's remember the importance of inclusivity. Let's strive to ensure that the power of AI doesn't become a tool for the privileged few, but a catalyst for global health improvement. Making sure the benefits of AI in public health reach every corner of our planet. From remote villages using AI-powered apps for disease diagnosis, to urban centers deploying AI for efficient vaccine distribution, the impact is real, and it's growing every day. Let's delve into some compelling real-world examples. In India, a country with a population of over 1 billion, AI is being utilized to predict and control the spread of infectious diseases. An innovative AI model analyzes environmental factors and social media posts to forecast disease outbreaks, providing valuable lead time for healthcare professionals to take preventive measures. On the other side of the globe, in the United States, AI is revolutionizing the fight against chronic diseases. For instance, advanced algorithms are being used to predict the onset of conditions like diabetes and heart disease, enabling early intervention and potentially saving millions of lives. In Africa, AI is playing a crucial role in addressing the challenge of limited healthcare resources. For instance, in Rwanda, an AI-powered drone delivery system is ensuring the timely delivery of critical medical supplies to remote areas. This innovative application of AI is literally making the difference between life and death, for many. In Europe, machine learning models are being used to improve mental health services. These models analyze patient data to identify patterns and predict mental health crises, enabling healthcare professionals to provide proactive care and support. And finally, in Asia, AI is being harnessed to combat the spread of mosquito-borne diseases. AI-powered predictive models are being used to map mosquito breeding sites and predict disease outbreaks, helping to prevent millions of cases of diseases like dengue and malaria. These are just a few examples of how AI is making a significant difference in global health. From predicting and preventing disease outbreaks to improving patient care and delivering critical medical supplies, AI is proving to be an invaluable tool in our fight against global health crises. The impact is real, and it's growing every day. The journey of AI in fighting global health crises is just beginning. Today we've uncovered the transformative role of artificial intelligence in reshaping global health. We've seen how AI is not just a buzzword but a powerful ally, analyzing vast amounts of data, identifying disease patterns, predicting outbreaks, and developing strategies for prevention and control at speeds and scales beyond our imagination. But AI's role doesn't stop at data analysis. It's on the front lines, assisting in diagnostics, patient care, and even in the development of new treatments and vaccines. AI tools are helping diagnose diseases earlier and with greater accuracy, translating into faster treatment and better outcomes for patients worldwide. Yet, as we continue to harness this power, we grapple with important questions about privacy, ethics, and equity. It's crucial to ensure that AI applications in health are ethical, secure, and accessible to all, regardless of where they live. Initiatives around the globe aren't only focusing on innovation, but also on inclusivity, striving to make the benefits of AI in public health reach every corner of our planet. We've heard real-world examples of AI's impact, from remote villages using AI-powered apps for disease diagnosis, to urban centers deploying AI for efficient vaccine distribution. The impact is real, growing every day, and touching lives in ways we've never thought possible. As we stand on the brink of this new frontier, we can see the potential of AI to save lives, streamline healthcare, and create a healthier future for all. The transformative journey of AI in health is just beginning. It's a journey filled with promise and potential, with challenges and opportunities, and it's a journey we're all part of. As we've seen today, its potential to save lives, streamline healthcare, and create a healthier future for all is just beginning. Thanks for joining us, and remember to stay curious, stay informed, and stay healthy.
Welcome back to the Victory Education Lounge, where we explore the frontiers of technology and education to empower your future. Today, we're embarking on a fascinating journey, one that takes us to the intersection of technology and public health. We're diving into a topic that's not only timely but also transformative: the unseen impact of artificial intelligence on public health. Now, when we think of AI, we're often caught up in images of self-driving cars, personalized shopping experiences, or even helpful home assistants. But there's more to AI than meets the eye. Its impact extends far beyond our daily conveniences, reaching into a realm that affects all of us: our health. AI has been steadily making its mark in the healthcare sector, and it's revolutionizing the way we approach public health. From predicting disease outbreaks to personalizing patient care, AI is changing the game. Imagine being able to predict an influenza outbreak before it happens, or being able to map the spread of chronic diseases across continents. This isn't a scene from a sci-fi movie, but a reality made possible by AI. By harnessing the power of machine learning and data analytics, AI can analyze vast amounts of health data, identifying patterns and trends that would take humans years to discern. But the power of AI doesn't stop at data analysis. It also extends to patient care. AI can tailor health interventions to individual patients, taking into account their unique health history and risk factors. This personalization of care can lead to more effective treatments and better health outcomes. However, even as we marvel at these advancements, it's crucial to address the challenges and ethical considerations that come with them. Questions around data privacy, security, and potential biases in AI algorithms are all pressing issues that need to be addressed as we move forward. Artificial intelligence, or AI, has been a buzzword for years, promising a future filled with intelligent robots and automated services. But beyond these flashy headlines lies AI's real power, its ability to transform public health in ways we're just beginning to understand. Let's start with the basics. AI in public health uses algorithms and machine learning to predict, understand, and respond to health crises. These aren't just any algorithms, but ones designed with the ability to learn and improve over time. This self-improving nature of AI is what sets it apart from traditional computing. Think of it as a detective with a magnifying glass, sifting through mountains of health data, looking for clues that might hint at a health issue. But instead of months or even years, it takes AI mere seconds to analyze this data. This speed and efficiency is what makes AI such a game changer in public health. So, how does it work? AI uses machine learning, a subset of AI, where a system is trained to learn from data. It starts by analyzing a set of data, looking for patterns. Once it identifies a pattern, it uses this knowledge to make predictions or decisions without being specifically programmed to perform the task. Now, in the context of public health, this could mean analyzing a vast array of health data, such as hospital records, lab results, and even social media posts, to predict the onset of a disease outbreak. This is a complex task that would take humans an enormous amount of time, but AI can do it in a fraction of the time. Let's take a step back and look at the bigger picture. Public health is all about preventing disease and prolonging life within entire communities. It's about identifying potential health risks and implementing strategies to mitigate them. AI helps in this by analyzing data to predict these risks, allowing public health officials to intervene and prevent a health crisis before it even happens. But AI's role doesn't stop at prediction. It goes a step further by providing insights into how diseases spread within communities. By analyzing data such as travel patterns, living conditions, and even weather trends, AI can map the path of a disease, allowing for a more targeted and effective response. Moreover, AI can also help understand the spread of chronic diseases. By analyzing long-term data, AI can identify patterns and trends, providing valuable insights into how these diseases evolve over time. This can inform strategies to combat these diseases, again highlighting AI's predictive and preventive potential in public health. From predicting outbreaks like flu seasons or pandemics, to understanding the spread of chronic diseases, AI gives us a bird's-eye view of public health. It's like having a superpowered microscope that not only shows us what's happening now, but can also predict what might happen in the future. In a world where health crises can emerge quickly and spread rapidly, this ability to predict and respond swiftly is invaluable. It's a powerful tool that could revolutionize public health, making us better equipped to safeguard the health of our communities. But how is this technology used in the real world? One example is in disease surveillance. AI, with its superior data processing capabilities, is revolutionizing the field of epidemiology. It's like having a superpowered detective on the case, sifting through mountains of data to identify potential health threats. Consider the vast world of social media. Every day, billions of posts, tweets, and comments are made worldwide. Buried within this digital chatter, there are subtle signals of emerging health issues. AI algorithms can scan these vast data sources in real time, spotting patterns and anomalies that might signal an outbreak. This method of disease surveillance isn't theoretical. It's being used right now. During the Ebola outbreak in West Africa, AI algorithms identified a potential outbreak 9 days before the World Health Organization announced it. In those crucial 9 days, preparations could have been ramped up, potentially saving thousands of lives. AI's potential doesn't stop at early outbreak detection. It's also transforming the way we approach patient care. By analyzing a patient's medical history, genetic data, and lifestyle factors, AI can predict health risks and suggest personalized treatment plans. Let's say you're a 40-year-old woman with a family history of heart disease. Based on your age, gender, and family history, an AI system can predict your risk of developing heart disease. It can suggest lifestyle changes, such as diet and exercise routines, to mitigate this risk. It might also recommend regular screenings for early detection. But AI's role in personalized care goes even further. It can predict how you'll respond to certain medications based on your genetic makeup and help doctors tailor your treatment accordingly. This kind of precision medicine is the future of healthcare, and it's being made possible by AI. AI is also making strides in mental health care. By analyzing patterns in speech and writing, AI can detect signs of mental health issues like depression or anxiety. This can lead to early intervention and better patient outcomes. So imagine a world where your smartphone doesn't just track your steps or remind you to drink water. It's your personal health advisor equipped with AI that monitors your health data, predicts potential health issues, and suggests lifestyle changes to prevent them. This is not a far-off future. This is happening right now thanks to the power of AI. From detecting disease outbreaks to personalizing patient care, AI is making a profound impact on public health. But as with any powerful technology, it comes with challenges and ethical considerations, which we'll delve into in our next segment. For now, let's marvel at the transformative power of AI in public health. Imagine an app that not only tracks your health data, but also predicts potential health issues and suggests lifestyle changes to prevent them. However, with great power comes great responsibility. The use of AI in public health raises important ethical questions. With AI's ability to collect and analyze vast amounts of data, it is essential to address the elephant in the room: privacy and security. As we entrust AI with our most sensitive data, we must ask, how is this data protected? What safeguards are in place to prevent it from falling into the wrong hands? And what happens if it does? These questions are not merely hypothetical. Data breaches are a real and present danger in our increasingly digital world. It's not just about the immediate harm of financial loss or identity theft. When health data is involved, the stakes are even higher. A breach could expose intimate details of our lives and our bodies, information we may not want to share with anyone, let alone the entire world. Beyond privacy and security, there's another pressing concern: potential biases in AI algorithms. AI is only as good as the data it's trained on. If the data is biased, the AI will be too. This could lead to unequal healthcare, where certain groups get better care than others based on factors like race, gender, or socioeconomic status. For instance, if an AI is trained predominantly on data from wealthy white patients, it may not perform as well when treating poor minority patients. Even when data is unbiased, AI can still perpetuate inequality. Imagine a world where AI is used to predict health risks and suggest personalized treatment plans. In such a world, those who can afford to access this technology will have a significant advantage over those who cannot. They will be able to prevent diseases before they occur, while others will still be stuck in a reactive healthcare model, treating diseases after they've already taken hold. So how do we navigate these ethical minefields? First and foremost, we need robust regulations to protect privacy and security. We need to ensure that health data is only used for its intended purpose and not misused or exploited. We also need to ensure that those who violate these regulations are held accountable. But regulations alone are not enough. We also need transparency in AI algorithms. We need to know how these algorithms make their decisions, so we can identify and correct biases. And we need to ensure diversity in data sets, so that AI's benefits are accessible to all, not just a privileged few. Lastly, we need to foster a culture of ethical AI use. We need to educate healthcare professionals about the ethical implications of AI and empower them to use this technology responsibly. We need to involve patients in decisions about their data, giving them a say in how it's used and who has access to it. And we need to engage the public in conversations about AI and ethics, so we can collectively shape the future of healthcare. Transparency in AI algorithms and ensuring diversity in data sets is crucial to avoid biases that could harm rather than help. So, what does the future hold? With advancements in AI, we're looking at a world where health interventions are more proactive than reactive. Instead of treating diseases as they occur, we can prevent them before they take root. This is the future of AI in public health, a future where prevention is key and technology leads the way. Picture a world where AI systems monitor public health data in real time, catching and responding to potential outbreaks faster than ever before. This could mean the difference between a contained disease and a global pandemic. Imagine the lives saved, the suffering prevented. But it's not just about disease prevention. AI can also revolutionize how we approach chronic health conditions. By analyzing individual health data and lifestyle factors, AI can predict the risk of chronic diseases like diabetes, heart disease, or cancer, and provide personalized advice on how to reduce these risks. This means we can intervene early, changing our habits and lifestyles before these diseases take hold. And let's not forget about mental health. AI can help us understand the complex factors that influence mental health and provide insights into how we can promote mental well-being on a large scale. From identifying patterns in social media posts that signal mental distress, to providing AI-powered mental health apps, the potential for AI in mental health is vast and largely untapped. AI can also democratize healthcare, making high-quality health advice and treatment accessible to all, regardless of location or income. With AI-powered telemedicine, anyone with a smartphone can consult with a healthcare professional or receive personalized health advice. This could revolutionize healthcare in remote or underserved areas, providing people with the healthcare they need when they need it. But this future isn't guaranteed. It will require collaboration between AI specialists, healthcare professionals, policymakers, and the public. It will require rigorous ethical standards to ensure that AI is used responsibly, with respect for privacy and equality. And it will require continuous learning and adaptation as we navigate the challenges and opportunities of this new frontier. We're at the dawn of a new era in public health, an era where AI can help us understand and improve health on a global scale, where we can predict and prevent diseases before they occur, and where everyone has access to the healthcare they need. It's an exciting future, full of possibilities, but as we move forward, let's remember that technology is only a tool. It's how we use it that will determine its impact. Let's use AI to create a world where everyone can live healthier, happier lives. A world where public health isn't just about treating diseases, but preventing them. A world where health is a human right, not a privilege. The potential of AI in public health is immense, and we're just scratching the surface. Stay tuned, stay informed, and stay healthy.
Welcome to the Victory Education Lounge, your go-to spot for insights into the future that's being shaped by technology today. If the intersection of artificial intelligence and healthcare sparks your interest, you're in the right place. We delve into how this powerful combination is revolutionizing our world, specifically in managing infectious diseases. From common flu to pandemics like COVID-19, these health threats have always posed significant challenges. But as we step into the future, we have a new ally: artificial intelligence. This isn't just a buzzword anymore, but a tool that's beginning to transform the public health sector. We encourage you to stay tuned as we explore this fascinating topic further. Don't forget to hit the subscribe button and turn on notifications so you won't miss our future explorations. Today, we're diving deep into how AI is reshaping the battlefield against infectious diseases. First, let's understand the scope. Infectious diseases have been the bane of mankind for centuries. From the Black Death in the 14th century that claimed millions of lives to the Spanish flu in the early 20th century, and more recently, the COVID-19 pandemic that shook the world. These diseases have posed significant challenges to public health, disrupting societies, economies, and everyday life. In our battle against these invisible enemies, we're constantly on the lookout for new allies. And in this digital age, we found a powerful one: artificial intelligence, or AI. AI, with its ability to process and analyze vast amounts of data, is now playing a pivotal role in managing infectious diseases. It's helping us to detect outbreaks, track their spread, and even predict future hotspots. It's like having a super-powered epidemiologist on our team, working around the clock, tirelessly crunching numbers and spotting patterns that the human eye might miss. But AI isn't just about data analysis, it's also about real-time response. AI can help healthcare professionals make informed decisions quickly, ensuring timely intervention and potentially saving lives. It can help us understand how diseases spread, how they may evolve, and how we can best counteract them. At the same time, AI is also revolutionizing the way we develop treatments. From speeding up the process of drug discovery to personalizing treatments based on a patient's unique genetic makeup, AI is becoming an invaluable tool in our healthcare arsenal. However, the power of AI doesn't stop at the individual or community level. It's also transforming the way we approach public health on a global scale. By connecting dots across borders, AI is helping us create a global network for disease surveillance and response, enhancing our collective ability to fight infectious diseases. In essence, AI is not just a tool for the present, but a promise for the future. It's an ally that's already changing the game in our fight against infectious diseases, and its potential is only just beginning to be realized. But with the advent of AI, we have a new ally in this fight. AI can analyze vast amounts of data from various sources. This statement underscores the potency of artificial intelligence in the field of infectious disease management. But don't just take our word for it. Let us hear from the experts. Our first expert, a leading researcher in AI and public health, highlights the game-changing role of AI in early disease detection. She says, artificial intelligence has the ability to sift through mountains of data, identifying patterns and anomalies that might otherwise go unnoticed. This means that AI systems can spot disease outbreaks even before they're officially reported, providing us with an early warning system that is invaluable in preventing the spread of infectious diseases. This early detection is just the first step. AI does not stop at identifying the problem. It goes a step further to provide real-time monitoring of the situation. This is crucial in tracking the progression of an outbreak and informing the response strategy. Our second expert, a pioneer in AI-based disease prediction models, elaborates on this. He says, AI's role goes beyond just detection. These systems can predict how diseases might spread, based on a variety of factors such as population density, travel patterns, and climate conditions. This predictive capability allows us to take proactive measures to contain the disease, instead of merely reacting to it. It's clear that AI is not just a tool for analyzing data, but a powerful ally in the fight against infectious diseases. By providing early detection and real-time monitoring, AI enables us to stay one step ahead of disease outbreaks. But perhaps the most impressive aspect of AI is its predictive capability. By forecasting how diseases might spread, AI empowers us to take preventive action, potentially saving countless lives. In conclusion, as our second expert aptly puts it, it's not just about detection. AI systems can predict how diseases might spread, helping us take proactive measures. This is the transformative power of AI in managing infectious diseases. As we continue to harness this power, we move closer to a future where infectious diseases are less of a threat to public health. But how does this all work in real life? Let's dive into a real-life case study to shed some light on the practical applications of AI in infectious disease management. Imagine a bustling city, with millions of people going about their daily lives. Unbeknownst to them, a new strain of flu is beginning to spread. Traditional methods of detection, such as hospital reports and laboratory tests, can take days or even weeks to identify an outbreak. But with AI, this timeline changes dramatically. AI systems are like tireless sentinels, continuously monitoring a vast array of health reports, travel data, and social media chatter. In this case, the AI detected an unusual rise in online discussions about flu-like symptoms in the city. This was happening even before local health departments were aware of any significant changes in the number of flu cases. But catching this anomaly was just the first step. The AI then cross-referenced this information with other data points. It looked at recent travel patterns, weather conditions, and even local events that could contribute to the disease spread. It was like piecing together a complicated puzzle, but the AI was up to the task. As the AI began to see a pattern, it alerted the relevant health authorities. Now, this is where the real magic happens. Armed with this early warning, the authorities were able to respond swiftly. They issued public health advisories, ramped up flu vaccinations, and implemented preventive measures in high-risk areas. All these actions took place even before the traditional disease surveillance methods would have flagged an outbreak. By the time the first official cases were reported, the city was already equipped to tackle the disease head-on. And the results? Well, they were nothing short of remarkable. The early intervention managed to contain the outbreak, reducing the number of people who fell seriously ill. This not only saved countless lives but also lessened the burden on healthcare facilities. But it's not just about the numbers. It's about the human stories behind those numbers. It's about the grandmother who could continue to babysit her grandchildren, the teacher who didn't have to miss a day of school, and the nurse who stayed healthy to care for her patients. This early warning gave authorities precious time to respond, potentially saving thousands of lives. And this is just one example of how AI is revolutionizing the way we manage infectious diseases. So next time when you hear about AI in healthcare, remember this case study. It's a testament to how technology can help us stay one step ahead in our fight against infectious diseases. AI's impact goes beyond borders. This powerful tool is not merely a local or regional ally, but a global sentinel, steadfastly monitoring health trends and potential threats across nations and continents. Imagine this, a network that never sleeps, tirelessly scanning, analyzing, and correlating data from disparate sources to safeguard our collective health. This global network of disease monitoring enabled by AI is like a digital spider web. Each strand represents a data source, be it health reports from a remote village in Africa, travel logs from a bustling airport in Asia, or social media trends from a city in Europe. Together, these strands weave a comprehensive picture of global health, a picture that is constantly updated in real time. The beauty of this network lies in its ability to connect the dots, to find patterns and correlations that might elude even the most trained human eyes. By synthesizing data across borders, AI can identify potential health threats that are still in their nascent stages, hidden in the noise of everyday health fluctuations. Moreover, this global network is not just reactive, but predictive. By analyzing past and present data, AI can forecast future disease trends. It can predict potential hotspots of disease outbreaks, allowing authorities to take preemptive action, to mitigate risks before they become realities. This predictive capability is especially crucial in our interconnected world, where a health threat in one corner can quickly become a global concern. By staying one step ahead, we can better manage these threats, reducing the human and economic toll they can potentially wreak. And as AI technology continues to advance, this global network will only become more robust, more accurate, and more far-reaching. It will enable us to not just respond to infectious diseases, but to anticipate them, to prepare for them, and ultimately, to control them. So as we look to the future of public health, we see a horizon illuminated by the promise of AI. It connects dots that were once invisible to the human eye, and in doing so it brings us closer to a world where infectious diseases are not just managed but preempted. Of course, the integration of AI in public health is not without its challenges. As we harness the power of artificial intelligence to combat infectious diseases, we must also navigate a complex landscape of ethical considerations and potential pitfalls. Firstly, we encounter the critical issue of data privacy. AI thrives on data, the more, the better. But this data often includes sensitive personal information. We have to ensure that the privacy rights of individuals are respected and that data is utilized responsibly. This is where robust data protection regulations come into play. They help in maintaining a delicate balance between leveraging data for public health benefits and preserving individual privacy. Secondly, we have the ethical use of information. AI systems must be designed and used in a manner that upholds the highest standards of ethical conduct. This includes ensuring the accuracy of data, avoiding biases in AI algorithms, and being transparent about how AI systems make their decisions. Ethics in AI is not just about doing things right, it's about doing the right things. Lastly, but certainly not least, is the issue of equity. As we integrate AI into our public health strategies, we must ensure that these technologies are accessible to all, regardless of geographic location, socioeconomic status, or other factors. The benefits of AI should not be limited to the privileged few. They must be shared equitably among all. This means investing in infrastructure, education, and resources to make AI tools universally accessible. As we move forward, these challenges will continue to evolve, and so must our strategies to address them. We must foster a culture of continuous learning and adaptation. It's a complex journey, but one that's worth undertaking for the immense potential benefits AI offers in managing infectious diseases. These are issues that must be addressed. As we embrace the future of AI in public health, we must do so with a clear understanding of these challenges, and a commitment to navigate them with wisdom, responsibility, and a relentless pursuit of equity and justice. Despite these challenges, the future looks promising. As we delve deeper into the 21st century, the ongoing advancements in artificial intelligence are creating a seismic shift in how we approach public health, particularly in the management of infectious diseases. From early detection to real-time monitoring and predicting disease spread, AI has proven to be a formidable ally in our fight against these health threats. Its ability to analyze vast amounts of data, sometimes in the blink of an eye, is not just impressive but crucial in a world where time is often of the essence. The power of AI lies in its ability to learn and adapt. Machine learning algorithms, a subset of AI, are being trained to understand the complexities of infectious diseases, from their transmission dynamics to the factors that influence their spread. This allows us to not only respond to outbreaks more effectively, but also to anticipate them, giving us a fighting chance against diseases that have, for so long, held the upper hand. But it doesn't stop there. As we push the boundaries of what's possible with AI, we're beginning to see its potential in other areas of public health. AI is being used to optimize resource allocation, ensuring that aid gets to where it's needed most during an outbreak. It's helping us understand the social determinants of health, shedding light on the complex interplay between environment, behavior, and disease. Furthermore, AI is revolutionizing disease surveillance. Instead of relying solely on official reports, we're now able to tap into a wealth of data from online sources. Social media posts, news articles, and even search engine queries can all provide valuable insights into potential outbreaks, often in real time. This is a game changer in disease management, allowing us to stay one step ahead of infectious diseases. Of course, it's not all smooth sailing. As we embrace AI, we must also grapple with the ethical and logistical challenges that come with it. Data privacy, equitable access to technology, and the potential for AI to be misused are all issues that need to be addressed. But with careful planning and regulation, we can navigate these hurdles and harness the full potential of AI. In this journey, collaboration will be key. It's not just about tech companies and healthcare providers working together. Everyone, from policymakers to the public, has a role to play in shaping the future of AI in public health. After all, it's not just about the technology itself, but how we use it to create a healthier, safer world. As we stand on the brink of a new era in public health management, one thing is clear. AI will be at the forefront, transforming our approach to infectious diseases. The future of public health is not just about fighting diseases, but predicting, preventing, and managing them in ways we never thought possible. And in this future, AI is not just a tool, it's a game changer. Hello and welcome to the Victory Education Lounge, your go-to place for cutting-edge insights and knowledge that empower your mind and future. Today, we're embarking on an enlightening journey into the world of artificial intelligence, or AI, and its transformative role in health surveillance. But before we delve into the heart of the matter, let's lay down the basics. Health surveillance is the cornerstone of public health. It involves the systematic collection, analysis, and interpretation of health-related data. This continuous process allows us to plan, implement, and evaluate public health practices. It's our first line of defense against health threats, enabling us to detect, monitor, and respond to potential epidemics swiftly. In a world where health threats are always on the horizon, staying one step ahead is not just beneficial, it's crucial. This is where the power of artificial intelligence comes into play. AI, with its ability to process and analyze vast amounts of data at lightning speed, is revolutionizing the field of health surveillance. We're not just reacting to health threats anymore, we're moving towards predicting them. Imagine being able to identify patterns and anomalies in health data that would take humans considerably longer to notice, if at all. AI is making this possible. It's transforming how we approach public health, equipping us with the tools to predict potential epidemics before they happen. Consider the impact of such technology. By predicting outbreaks before they occur, we can mobilize resources, inform public policy, and implement preventative measures. The potential to significantly reduce the spread and impact of diseases is immense. But as with any powerful technology, the path forward is not without its challenges. From data privacy concerns to the need for global cooperation, the integration of AI into health surveillance raises important ethical considerations. In this journey, we will explore the benefits, the workings, the successful instances, the challenges, and the ethical implications of AI in health surveillance. Today, we're exploring how artificial intelligence, or AI, is revolutionizing the field of health surveillance and enabling us to predict epidemics before they even happen. By integrating AI into health surveillance, we're not just reacting to epidemics, we're moving towards predicting them. This shift from reactive to proactive is made possible by the incredible processing power of AI, which can sift through and analyze vast amounts of data at a speed and precision that far surpasses human capabilities. Imagine a global health network that never sleeps, tirelessly combing through mounds of data, seeking out the faintest whispers of potential health threats. This is the reality of AI in health surveillance. From hospital records and lab reports to social media posts and climate data, AI algorithms can ingest and analyze a wide variety of data sources, identifying patterns and anomalies that might indicate the emergence of a disease outbreak. But the power of AI doesn't stop at data collection and analysis. It's also instrumental in generating predictive models, providing an early warning system for potential epidemics. By recognizing patterns in historical and real-time data, these models can forecast the likelihood of an outbreak, allowing us to take preemptive action. The role of AI in recent health crises cannot be overstated. AI-driven tools have been at the forefront of early detection and response efforts, providing critical insights that have informed public health strategies and undoubtedly saved lives. For instance, during the COVID-19 pandemic, AI was instrumental in tracking the spread of the virus, predicting hotspots, and informing resource allocation. In essence, AI is transforming the field of health surveillance, turning it into a proactive rather than reactive discipline. It's helping us move from merely responding to health crises to predicting and preventing them. This shift holds immense potential for public health, promising a future where epidemics can be anticipated and mitigated before they wreak havoc on our communities. AI can identify patterns and anomalies in data that would take humans much longer to notice, if at all. This capability, combined with AI's predictive power, is revolutionizing health surveillance, presenting us with a powerful tool in our fight against epidemics. AI models are trained on vast datasets, from hospital records to social media posts, learning to identify early warning signs of disease outbreaks. These models, often referred to as machine learning algorithms, are programmed to identify patterns, anomalies, and correlations within the data they process. This ability to sift through mountains of information and extract meaningful insights is at the heart of AI's potential in epidemic prediction. In the realm of health surveillance, these AI models are fed a variety of data. Hospital records, for instance, can provide a wealth of information about the types of illnesses currently affecting a population. This can help identify unusual spikes in certain diseases, which may signal the beginnings of an outbreak. Social media posts, on the other hand, offer a real-time snapshot of a population's health. By analyzing trends in what people are talking about online, AI can detect early signals of a potential epidemic. For example, a sudden increase in tweets about flu-like symptoms could indicate an impending influenza outbreak. Once these early warning signs are identified, the AI models then use predictive analytics to forecast the trajectory of the potential epidemic. This involves analyzing the patterns identified in the data and using mathematical models to predict how the disease might spread. These predictions can then be used to take proactive measures. This could mean mobilizing healthcare resources, implementing public health interventions, or informing public policy decisions. The aim is to prevent the outbreak from escalating into a full-blown epidemic, or at the very least, to mitigate its impact. The power of AI in this context is truly transformative. It allows us to shift from a reactive stance, where we're constantly playing catch-up with disease outbreaks, to a proactive one, where we have the chance to get ahead of the curve. These models can then forecast potential epidemics, allowing for proactive measures. The potential of AI in predicting epidemics is immense, and as we continue to refine these technologies, the promise of a healthier future becomes increasingly tangible. The impact of such technology is profound. Let's delve into a case study that brings to life the power of AI in predicting disease outbreaks. We turn our attention to Blue Dot, a Canadian AI company that astounded the world in December of 2019. Their AI system was among the first to identify the emergence of a concerning cluster of pneumonia cases in Wuhan, China. This was almost a week before the World Health Organization released its first warning about what we now know as COVID-19. Blue Dot's AI was trained on multiple sources of data. This includes global airline ticketing data to track population movements, reports from animal and plant disease networks to identify potential zoonotic sources, and official health documents in all UN official languages. By integrating and analyzing these diverse datasets, the AI was able to pick up on the unusual pneumonia outbreak and alert the human team at Blue Dot. The early warning from Blue Dot allowed for a quicker response to the emerging threat. While it's difficult to quantify exactly how many lives were saved or infections prevented due to this early detection, there's no doubt that the early warning provided valuable time to prepare and respond. The Blue Dot case study shows how AI can sift through vast amounts of data, detect patterns and raise an alarm before an epidemic becomes widespread. It's like having a vigilant sentinel tirelessly monitoring the health landscape, ready to alert us at the first sign of danger. But the power of AI doesn't stop at detection. Once the Blue Dot system identified the outbreak, it went a step further. By analyzing global flight data, the AI predicted the initial spread of the virus from Wuhan to cities in Asia, Europe, and America. These predictions were later confirmed to be remarkably accurate, proving that AI can not only detect, but also predict the trajectory of an epidemic. This prediction capability is invaluable in the fight against diseases. It allows us to mobilize resources and implement preventative measures in areas predicted to be hit the hardest. For instance, hospitals can be prepared for an influx of patients, public health messages can be tailored and disseminated, and policies can be put in place to slow the spread of the disease. Moreover, such predictions inform global cooperation. By knowing where the disease is likely to spread, countries can work together in their response efforts, sharing resources and information to combat the common threat. The Blue Dot case study is a testament to the power and potential of AI in health surveillance. It illustrates how technology can help us stay a step ahead of diseases, giving us a fighting chance in the battle against epidemics. By predicting outbreaks before they occur, we can mobilize resources, inform public policy, and implement preventative measures, significantly reducing the spread and impact of diseases. This isn't just the future of public health, it's the present. And as AI continues to evolve and improve, our ability to predict and prevent epidemics will only get better. However, the path forward is not without its challenges. As we navigate the integration of AI into health surveillance, we encounter a landscape filled with both potential and pitfalls. On one hand, we have the promise of early detection and prevention of epidemics. On the other, we face complex ethical considerations that demand our attention and resolution. One of the most pressing issues is that of data privacy. With AI models being trained on vast amounts of personal health data, questions arise about how this information is collected, stored, and used. As we strive to harness the power of AI, we must also ensure that individuals' privacy rights are respected and protected. This is a delicate balance to strike, and it requires robust data governance frameworks, transparent practices, and stringent enforcement of privacy laws. Another challenge lies in the inherent biases that can be present in AI algorithms. These biases can result from a lack of diversity in the data used to train the models, leading to inaccurate predictions and potentially exacerbating health disparities. Therefore, when developing and deploying these AI systems, it's imperative to ensure the data is representative and the algorithms are transparent and explainable. The implementation of AI in health surveillance also calls for global cooperation. Epidemics do not respect borders. They can spread quickly and widely, affecting people in every corner of the world. Therefore, predicting and preventing them requires a collaborative global approach. This means sharing data and resources, coordinating efforts, and working together towards a common goal. However, this can be challenging due to geopolitical tensions, differing regulations, and issues of trust and transparency. Lastly, we must consider the impact on the healthcare workforce. While AI can augment and enhance our capabilities, there are concerns about job displacement and the need for new skills. It's crucial to provide education and training, not only to use these new technologies effectively, but also to understand their limitations and ethical implications. The path forward may be fraught with challenges, but they are not insurmountable. By fostering dialogue, promoting ethical practices, and encouraging international cooperation, we can navigate these obstacles and harness the full potential of AI in health surveillance. In conclusion, the integration of AI into health surveillance is a complex journey, filled with both promise and perils. It's a path that requires careful navigation, balancing the immense potential of AI with ethical considerations of privacy, fairness, and global cooperation. But it's a journey worth embarking on. Because at the end of the day, the goal is to protect and improve public health, to predict and prevent epidemics before they happen, and ultimately, to save lives. And so, as we continue to explore the frontier of AI in health surveillance, let's remember to do so with care, responsibility, and a commitment to ethical practices. Because the promise of AI is not just in its ability to predict epidemics, but also in its potential to promote a fair, equitable, and healthy future for all. The integration of AI into health surveillance raises important ethical considerations. The potential of AI in health surveillance is immense, offering a beacon of hope in our ongoing battle against epidemics. As we've seen today, these technological advancements are not just about predicting health threats, but about empowering us to act preemptively, to marshal resources and implement preventative measures before an outbreak occurs. We've delved into the many advantages of integrating AI into health surveillance. The ability to process and analyze vast amounts of data at lightning speed, identifying patterns and anomalies that might escape human analysis. This is not just about reacting to health crises as they unfold, but about shifting towards prediction, towards proactive public health strategies that can significantly reduce the spread and impact of diseases. We've also seen how AI models, trained on a diverse range of datasets, can detect early warning signs of disease outbreaks. From hospital records to social media posts, these predictive models harness the power of data to forecast potential epidemics. The implications are profound. With early detection, we can direct resources where they're most needed, inform public policy, and put preventative measures in place, all before an outbreak takes hold. But let's not forget, this journey into the future of health surveillance is not without its challenges. We've touched upon the ethical considerations that come with such advancements. Data privacy, the need for global cooperation, and the importance of navigating these challenges with care and transparency. These are not hurdles to be overlooked, but opportunities to shape a responsible and ethical framework for AI in health surveillance. In the face of these challenges, the potential of AI in health surveillance shines brighter than ever, illuminating the path towards a healthier future. A future where epidemics are predicted before they happen, where public health strategies are proactive rather than reactive, and where the power of technology is harnessed to safeguard our health and well-being. As we refine these technologies, as we continue to navigate the ethical landscape, the promise of a healthier, safer future becomes increasingly tangible. A future where the power of AI is fully realized, where health surveillance is not just about monitoring, but about predicting, about empowering us to stay one step ahead of health threats. The potential of AI in health surveillance is immense, a beacon of hope in our ongoing battle against epidemics. And with every step we take on this journey, with every challenge we overcome, we move closer to that future, a future where health threats are predicted before they happen, where the power of AI is fully harnessed to safeguard our health and future. Thank you for joining us at the Victory Education Lounge. Remember, knowledge is the first step towards victory. If you found this video insightful, don't forget to like, share, and subscribe.